The first question which we'd like to ask is, what is the purpose for GI screening test?
The purpose of GI screening test is to detect or diagnose some diseases which are present but still they are not symptomatic. Means the patient does not have any symptoms but still there is some disease inside. Say for example, cancers. For example, cancers for a long time they are in the body without any symptoms. So if we can identify these tumors at a stage where they don't have symptoms, they are early, then there is a very high chance that we can cure them. There are many other lifestyle disorders also which can stay in the body without causing symptoms. So the idea of screening test is to identify these asymptomatic diseases.
Are there any specific signs or symptoms which promote me to undergo this GI screening test?
Yes, there are two types of GI screening tests. The first is when the patient does not have any symptoms. Person when does not have any symptoms, this is called health checkup, or we call it as a primary screening. So in this situation, we can do some tests, some battery of blood tests, and in an elderly person, we can also do some tumor markers, which can help us to detect tumors. Uh, Whereas there are some tests which are done when the person has some symptoms, but we still don't know what is the disease. So in such a situation, we can do some screening, or especially it is called high risk screening. When people have some diseases which have a higher risk of developing cancer, say for example, person has ulcerative colitis or reflux disease with Barrett's ulcer, then we can do repeated endoscopy check to detect early cancers. Or some people have polyps in the colon or in the rectum, then they need regular colonoscopy to detect cancer. So this kind of screening tests are done based on the particular disease, or which is also called the pre-malignant condition, the condition which can lead to cancer development.
How should I prepare for these GI screening tests? Should I have to fast before these tests?
There are several kinds of tests. Some of them are blood tests, and some of these blood tests will require fasting. For example, sugar, diabetes checkup, or cholesterol checkup, thyroid checkup. These are the tests which will need fasting. Then there are some tests which are ultrasound of the abdomen. This will also require in a fasting state. And then there are some tests like CT scan. Also, they will need to be on some hours of fast, and endoscopy. Endoscopy patients also will require some fasting because you need an empty stomach to do endoscopy. Sometimes you need injections or sedation, or some injections, short anesthesia for endoscopy, which also requires fasting state. So most of the tests must be done on a fasting state, and it is better for the person to come to the hospital. Whenever they come to hospital, they should come on a fasting state.
So, how these tests are performed? Are they painful?
So many of these tests are not painful. Most of these tests are not painful. The blood test require only a prick. Ultrasound is a completely painless test. CT scan also does not cause any pain, but sometimes you have to take some liquids or injection to do a CT scan. And then endoscopy tests are done generally with the short anesthesia or sedation, so that it does not cause any discomfort or pain to the person who is undergoing this test. So essentially, there is no pain or discomfort involved. It is only the fear that people have in the mind about this test. Otherwise, there is not much pain or discomfort.
Will I be sedated or any kind of anesthesia during this procedure?
Yes, some of the tests, as I mentioned, like the endoscopy test, may require sedation or short anesthesia. Most of the tests are done without any sedation or anesthesia, and sedation anesthesia is also given to make the person calm, comfortable, and not cause any bad memories or pain of the investigations. And that is why a short sedation or anesthesia is done only for the procedure. As soon as the procedure is over, one will be out of anesthesia and they can start liquids and then soft diet and start resume their work.
And will I be able to resume my duties immediately after these procedures?
Most of the tests you can resume your normal activities immediately, but whenever some sedation or short anesthesia is given, it takes a little bit time to recover, say 1 or 2 hours, when liquids and then semi-solids will be started. People cannot drive back home on their two-wheelers or four-wheelers, on their own after a short anesthesia. They have to be, somebody has to accompany them to home, and then after going home, after 2 hours, they can eat and then they can start their routine work.
What are the potential risks or complications after undergoing this procedure or test?
These tests are very safe. There is generally no risk or complications associated with these tests. Blood tests are harmless. Rarely they can cause some hematoma or some slight pain at the site. Ultrasound is a completely harmless test. It uses ultrasonic energy and there is no risk factors. CT scan also uses radiation X-rays, but they are very safe. They can be done repeatedly because these days the CT scan machines are so good that very little radiation is given to the person. Endoscopy tests are also very safe. They require a short, sometimes sedation or anesthetic, but in this is also very safe, and they are, they recover very fast after the procedure is done. So essentially, these tests are very safe. One need not worry. Even if they are needed to be done repeatedly, they are very safe. And this test only, there is a cost involved to this test, but the safety wise, there is not much problem. It is a very safe test.
And another commonly asked question is, what is the cost of this procedure or test? Will it be covered with my insurance or not?
So the cost will depend on what kind of package the person takes. There are several packages for screening tests. Some are only blood tests, some are along with the ultrasound, X-ray, some are along with the ECG, treadmill, some are along with CT scan, and some are also along with the endoscopy. So based on what kind of package you take, the prices or the cost will vary depending on, you can ask your doctor what is the package which is suitable to you, what you should do it. And these tests are generally not covered by insurance because these are done on outpatient basis. Most of the insurance schemes or rules does not cover outpatient hospital outpatient tests or tests for use for diagnosis or for screening. But most of the policies does give you a health checkup plan which are covered. So you should try and inquire your insurance policy to see whether that is covered. Number one. Number two is that you should also check newer policies where nowadays they cover the health screening and the health checkups are now part of the policies also. So when you are taking a new policy, you can inquire into these details and find out what is the best policy for you.
Do I need to undergo these tests regularly?
Yes, this test will be required. It is not one point contact because one time you cannot detect all diseases. Over a period of lifetime, you will need some regularity of test based on the detecting the the regularity based on what kind of tests are done. Generally, we start this screening test from the age of 40 or at the most 45 when the problems start happening or developing. Initially, the blood test can be done every 1 yearly as annual routine checkup for diabetes, cholesterol, vitamins and deficiencies and other things. Thyroid and cholesterol can be done every 2 yearly. Then ultrasound is a simple test, can be done every 2 yearly. Then there are some specialized tests like CT scan which can be done every 5 yearly, or endoscopies based on what is the condition, they can be done every 5 or 10 yearly. They can be done like colonoscopy can be done once in 10 years to identify any polyps or any cancers, and one can do stool occult blood or to detect early amounts of blood in the stool like every yearly to detect if there is small amount of blood passing in the stool.
How often should I have a GI screening test done for early detection or preventive purposes?
So all these tests will be required to be done based on what kind of disease that we are looking for, what we want to identify, what we want to prevent. If they are based for health checkup or for lifestyle disorders, then yes, they will need to be done every 1 or 2 years. If they are used to detect cancers, then yes, every 2 years or sometimes even every 5 years we may need to do the test. You'll have to consult your doctor to identify what is the best time for you to get this test routinely, and it can help us.
Any experiences where this GI screening has helped the patient for better treatment?
If you talk of GI screening in all the well-developed countries like America, Europe, Japan, Australia, New Zealand, And most of these countries, they have a routine screening test which are done as part of the routine, and these are also covered by their insurance, or when they are social countries like Europe, where the state pays for the tests also for insurance. So for example, colonoscopy starts every 40 at the age of 45 years, and then it is done once in 5 or 10 years, depending on whether they see polyps or anything or not. So here in these countries, the detection of cancers, say for example colon cancers, is very early, and that's why there is a very high chance of cures. Almost 80 to 90% of colon cancers are detected early. Whereas in India, the situation is completely different. We don't have any screening test for detection any cancers. And that's why most of the times 80% of cases when we detect cancers, when they become symptomatic, they're all advanced cancers, either stage 3 or stage 4 cancers. Only 10 or 20% of cancers are either in stage 1 or 2, which are detected accidentally when we are doing investigations for some other purpose. So in India, the situation is very different, and that's why our cure rates are not very high, because the detection rates are low, because there are no screening tests. And that's why it is important that we should detect. I can give you specific examples. Just a few days ago, I got a patient who was detected to have early diabetes, and then on investigation was ultrasound and CT scan was done. He was detected to have a pancreas cancer. It was completely asymptomatic. There was no symptoms, and this was a resectable tumor. We could remove the tumor, and we can cure such patients when they are detected early. Similarly, for some other diseases, we do an ultrasound for stone or pain abdomen, and we find a renal tumor or we find a prostate tumor, and we can cure these patients. So essentially, we should do this screening test often, so that we can detect early tumors. And if they can detect early tumors, one should not feel that, oh, I got something done or kuch mil gaya mere ko. One must be happy that we could detect the early tumor, because it is only during this detection that there is a chance of cure. Otherwise, most of the times when symptoms happen, the tumors are already more advanced, and the chance of cure is very rare.
Thank you, sir, for enlightening us on this topic.